Hey, Dr. Jerry Williams with Urgent Care 24/7, and I'm here to talk to you today about a very common but very difficult problem, low back pain. So, some of y'all may or may not know, but I'm a neurologist. I'm a child and adult neurologist. So, mostly in my adult neurology career, I've taken care of a lot of chronic back pain. And it's a very difficult problem to care for as a physician, but it's an even worse problem to deal with if you're the patient. But back pain's a very, very common presenting complaint to medical providers worldwide. And I want to talk to you a little bit about it because it's a very complicated topic. But if you're watching this video, you or a loved one or a friend is probably suffering from low back pain or has at some point. And I want to give you my perspective on it, but keep in mind this is kind of a neurologist's perspective. If you had an orthopedic spine surgeon or a neurosurgeon, they may have a totally different perspective on it, or a chiropractor for that matter, or a physical therapist. But I'm going to give you my perspective on low back pain, and I'm going to give you my 30 years of experience of treating patients with this very common complaint. Well, the thing about low back pain is there are so many things to hurt in the lower back. You go, wait a minute, what are you talking about? Well, there's muscles, there's nerves, there's tendons, there's bone, your kidneys are back there. And the frequency with which patients present with this complaint, I mean, it's probably one of the most common things we see at Urgent Care 24/7 nationally. If you had to nail down one complaint, I don't know, it might be pharyngitis, sore throat, but the second most common thing would probably be either headache or low back pain. I'm thinking it's probably low back pain. But we end up treating low back pain patients kind of in this generic wastebasket treatment. And that's really not the right way to handle low back pain, because what you have to do, and this sounds kind of elementary, but to get the right treatment plan, you really have to start off with the right diagnosis. And that's something that I think neurologists, my specialty, are very good at as a rule, is getting the proper diagnosis. So the first thing we like to do is try to nail down what's causing the pain. Is it musculoskeletal? Is it muscle? Is it bone? Is it tendon? Or is it nerve-related pain? And once, or is it a combination thereof? And once we have those details discerned, then we can go with more pinpoint accuracy with our treatment regimens to make sure that we nip it in the bud of where the pain is coming from. For example, a muscle relaxer for muscle spasm is not going to be as effective if you've got a primary nerve impingement problem, say from a herniated disc, or if you've got primary bone pain. So trying using the physical exam, and in some cases imaging, either CAT scan or MRI are the two most common, and looking for pathology and cause, and thinking about if it's an injury related low back pain complaint, what was the mechanism of injury that caused it? Was it overuse from heavy lifting, or repetitive overuse, or was the patient in a car accident, or did they have a fall? So once we take into account the mechanism of injury, then we can go chasing the proper diagnosis, and then we can narrow down the proper treatment plan. Now, we see a lot of patients with musculoskeletal pain. We use a lot of nonsteroidal anti-inflammatory drugs, intermittent doses of steroids, and centrally acting muscle relaxers such as methocarbamol or cyclobenzaprine, if you've heard of those, which are Robaxin and Flexeril, respectively. But we also will treat patients with medications that will help calm down the nerves if the pain is, we think, coming from nerve impingement or nerve irritation. And those can be very effective for patients. The one thing that in my practice I've always avoided in chronic back patients who are not terminal, if they don't have a terminal illness, if they have a terminal illness, totally different ballgame. But we don't use narcotics in chronic back pain patients. And I never have, and we've been always been very conservative that way. So the other thing that's really important is getting these patients, especially early on, into a good physical therapy program that can do core strengthening, weight reduction to get rid of any excess weight around their midsection, which can put a lot of pressure on the lower back. So exercise and appropriate physical therapy, weight loss, non-steroidals, steroids, intermittent steroids typically, and medications that help calm down nerve pain if there's a nerve-related component to the pain. One other thing that is a bit uncommon that people will sometimes have low back pain can come from shingles, where they have typically a subclinical, meaning there aren't many lesions on the skin of shingles, and they can be left with what's called a post-herpetic neuralgia if it happens to affect the sensory nerve distribution of the lower back. It can leave the patient with what's called a post-herpetic neuralgia, and that post-herpetic neuralgia can present as back pain. That's uncommon, but it does happen. So that's a quick overview of low back pain. The takeaway from this is there's lots of different things in the back that can hurt. And to get the right treatment plan, you got to have the right diagnosis. And I would encourage you, if you or a loved one or friend are suffering with low back pain, that you go get evaluated to get that proper diagnosis early on. Catching low back pain early and mitigating the causes of it can prevent you or the patient from becoming a chronic low back pain patient, which is not where you want to be. So I hope you found that useful, and if you or someone around you is having these symptoms, please go get seen sooner than later. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.